causes chronic diseases such as high blood pressure, high cholesterol, heart disease, type 2 diabetes, certain type of cancer, inflammatory disease such as arthritis, asthma, even Alzheimer's disease. And at the same time, I'm going to show you how even a small amount of weight loss not only can help you to prevent these diseases, but more important, treat and even reverse these medical conditions. It's important not only we know how much fat we have in our body, also where that fat is located, health-wise extremely important. I want to show you the CT scan of a belly. You may notice over here this pink area that shows fat under the skin. This is the fat actually we can pinch. This is not a bad fat. This is not a dangerous one. But what is dangerous, shown in the red color in the CT scan, this is a visceral fat. These are the fat literally sitting inside us on top of organs. This is the one that's causing all the health issues regarding high blood pressure, cholesterol, diabetes, and so on. Of course, we don't need to everybody have a CT scan of the belly in order to know whether you have extra belly fat or not. All you have to do, know your waist measurement. In order to know whether you have extra belly fat or not, all you have to do, measure your waist. Waist measurements more than 38 inches for men and more than 32 inches for women indicates extra belly fat. Some research shows that that might be actually too liberal. Now they're actually recommending the third option is if your waist measurement is more than half of your height in inches, that clearly indicates too much belly fat. The third option can be used for any gender, any age, any ethnic group. This is probably the most accurate way to monitor your belly fat. I want to show you how visceral belly fat causes all these diseases. Now research showed that extra belly fat, through the hormonal changes that creates in your body, increases the water sodium retention from your kidney, and that leads to your high blood pressure. So it's not surprising, even 10% of weight loss can correct your blood pressure, in most cases without need for medication. Extra belly fat releases the fat to the blood circulation, goes to the liver, and liver takes that fat and turns cholesterol and puts in your blood circulation. This is interesting, you know that over 85% of your cholesterol in your blood actually made in your own liver using your own belly fat. That's why dropping that belly fat can significantly lower your cholesterol and triglyceride problem, again in most cases without need for medication. Extra belly fat, by increasing blood pressure, cholesterol, significantly increased risk of developing cardiovascular disease, even over more than threefold, that's 300%. Belly fat also leading cause of a type 2 diabetes and pre-diabetic situation. What the belly fat causes creates conditions called insulin resistant. Insulin is a hormone that allows the sugar to get into the cell. Resistant means your body is not using insulin properly. When the sugar cannot get into the cell, stays in the blood, and that leads to type 2 diabetes. Again, very interesting, you should know that even 10% of weight loss not only completely reverses pre-diabetes situation, but if you continue losing more weight, yes, you can absolutely reverse your type 2 diabetes and control just through the nutrition and lifestyle. Also, belly fat creates a metabolic syndrome. This is a cluster of the symptoms such as high blood pressure, cholesterol, high triglyceride, good cholesterol, which all together triple risk of heart disease and five-fold increased risk of type 2 diabetes, that's 500%. Extra belly fat also significantly increased risk of certain type of cancer such as prostate, colon cancer, breast cancer. Extra belly fat is amazing. It produces a significant amount of inflammatory chemicals. These inflammatory chemicals can damage every single cell in your body and leads to arthritis, even asthma. So it's not surprising with a small amount of weight loss, you see a significant improvement in all these medical conditions. Extra belly fat, again, through the hormonal changes and these inflammatory chemicals, cause inflammation in the brain cell. That inflammation leads to production of a sticky protein called amyloid, just forms a plaque and kills the brain cell. Now you're connecting belly fat to Alzheimer's disease. Now you're saying bigger the belly, smaller the brain. Of course, also extra belly fat can lead to sleep apnea, which itself is a foundation for multiple medical problems. I want to catch your attention that you don't have to become statistics to change your life. All you have to do by cleaning up this belly fat, you can absolutely not only prevent these disease, but in most cases reverse these medical conditions. And that's a very significant step, because the reality is no treatment for any disease is better than prevention. It's time for you to educate yourself and actually empower yourself how to prevent a disease rather than try to correct the disease.